Hi everyone! Thanks for tuning in to the NUS Nursing Research Podcast series where we feature the latest works of our brightest minds. I'm Dr. Jocelyn Chew, a research fellow at the Alice Lee Centre for Nursing Studies. Here with us today is Dr. Seah Betsy, a research fellow at the Alice Lee Centre for Nursing Studies, National University of Singapore. She is a strong advocate for health promotion and has developed a personalised health resource intervention for community-dwelling older adults. Dr. Seah is also the co-founder and health resource specialist manager of a charity organisation called the Health Concepts and Measurements, in short, Healthier SG. Hi Dr. Seah, it's so nice to have you with us today. You know, Dr. Seah is actually my next door neighbour in the office, and I remember occasionally seeing her hobble by with a walking frame, thinking that it is most likely for her research. So Dr. Seah, is it really for your research?
Thanks for having me, Jocelyn. Yes, the walking frame is indeed for my research. So I use it in class to share about how it is a useful resource to aid in walking to the seniors. So whenever we talk about planning for old age, many people will associate it with financial planning. In fact, planning for old age goes beyond that. It includes adopting a healthy lifestyle, cultivating a positive mindset, going for regular health screenings, engaging in meaningful activities, and preparing for sudden onset of illness and long-term disabilities. Hello everyone, my name is Seah Betsy. I'm a research fellow from the Alice Lee Centre for Nursing Studies, National University of Singapore.
So I'm curious, how did you actually get into this whole research area on community health? Because I remember you were previously working in the emergency department.
Yes, I work in the emergency department as a registered nurse for several years. And you might be wondering, my research interest is in community care for older adults, which is very different from my clinical background in acute care. Where is that connection, right? Previously, when I was working at the emergency department, I would receive patients at their worst states. And many of them were seniors presenting with acute conditions that could have been prevented through daily lifestyle habits and self-care management. And that got me interested in how we could do this. So I'm now working on projects related to community care for older adults. I focus on upstream health interventions that seniors can engage in before they develop medical conditions and help them avoid visiting emergency department as much as possible.
So I know that you started a program called SHAPE, right? So could you maybe share a little bit more about why you think healthy aging is so important and what kind of issues are you actually trying to address through this program?
So in Singapore, our aging policy focus on aging in place, which means we support seniors to live independently in their homes for as long as possible. We have in place various elderly-centric initiatives and senior welfare provisions that make Singapore an age-friendly city. Examples of such initiatives include the Age Well, Live Well program by Health Promotion Board and People's Association to promote physical and mental health of seniors. The courses offered by C3A, National Silver Academy, to engage in lifelong learning. The enhancement for active seniors, EASE in short, by HDB, which is the Housing Development Board, to provide safer home environments. And there is also the Agency for Integrated Care, which is AIC, to reach out to caregivers and seniors with information on aging well and to connect them to the services that they need. So we are actually quite rich in these elderly-centric resources. However, many of the very elderly people did not receive much formal education. And even those who receive formal education, they might not be savvy in keeping up with these initiatives. In particular, seniors living alone or those with their spouse only might have fewer interactions, social interactions, and support of family members. Furthermore, even though Singapore is rich in health information portals, the elderly might find navigating such portals and services baffling. Besides, in the qualitative study where we interview older adults who stay alone or stay with their spouse only, they shared their concern about having access to immediate help when in medical distress. For example, if they suddenly turn unwell or fall at home. They hear of news, or some even know of people who pass away at home for a few days before being found. These older adults were afraid that by the time help arrives, it might be too late. To overcome these difficulties, I developed a health resource program to equip these seniors with better coping behaviors and strategies for them to age in place healthily.
So I keep hearing this word health resource. So could you share with us a little bit more about what exactly is health resource?
So health resources for older adults refer to characteristics that help them cope with stresses of healthy aging, such as experiencing physiological decline and having fewer social connections with others. So health resources can be both internal or external. Examples of internal health resources are resilience, having health knowledge, past experiences, and even their own state of health. And examples of external health resources are such as having social support from family and friends, the activities and services provided by community-based organizations, government support schemes, and having barrier-free access physical infrastructure.
Right, so there came the SHAPE program, right? So SHAPE is the short form for Salutogenic Healthy Aging Program Embracement. Wow. So what does the term salutogenic actually mean?
So the SHAPE intervention is underpinned by this theoretical concept known as salutogenesis. So the word salute means health and genesis refers to origin in Latin. So when we put them together, the term salutogenesis refers to origins of health. The concept of salutogenesis focuses on what creates health in people and how people use resources that they have to cope with these stresses in their lives. So this concept is different from the biomedical model that we are familiar with in healthcare, on pathogenesis, focusing on what causes diseases, the risk factors, and how we manage and prevent diseases. The Salutogenic Healthy Aging Program Embracement, which is SHAPE in short, is designed to inform older adults on how to identify, access, and use resources that are available to cope with aging processes and promote their health.
I think that's really interesting, especially when now we are talking about focusing on how to create health, right, instead of treating ill health. So could you share a little bit more about what this SHAPE program is about and who is it actually for?
So the SHAPE intervention is a health resource program that aims to promote healthy aging in 4 different aspects of health: the physical, psychological, social, and spiritual. So it is a 12-week program which comprises weekly group sessions and at least 2 individual home visits. It involves older adults living alone or those who stay with spouse only, and they must be aged 60 years and above.
Right, so it seems like this SHAPE program is a multi-dimensional program that is more suited for the elderlies, right, the seniors. That's what I understand from you. So actually, could you share a little bit more about what are the contents covered during each session or each visit?
Each group session focuses on a specific topic of aging. So topics covered include what are the normal aging processes, how to manage emotional health, how to eat nutritiously as a senior, how to prevent falls, and how to prepare for illness and end of life. Simple functional exercises and nutritious snacks were also introduced during each group session. So in fact, the key component of this program was the reflective personalized home visits. During the home visits, seniors would reflect on different aspects of their lives, and they would consolidate their learning from the group sessions, set specific health goals, and develop an action plan to work on these goals. Each senior would set health goals according to his or her health concerns or personal needs. As such, these health goals actually vary from senior to senior. So, for example, some seniors focus on increasing and intensifying their quad and calf exercises to strengthen their leg muscles, while other seniors, they start to attend more regular health screenings and dental checkups. A few of them wanted to pursue their individual interests at leisure, such as playing the ukulele and learning how to do crochet. So there are also others that set goals on discussing their care preferences and will-making plans with their family members.
Right, that sounds so interesting, especially when it seems to cover a very holistic view or holistic intervention for your participants, right? So, are there any feedbacks that you received from your participants or any impressionable moments that you feel are worth mentioning?
So in our pilot study, the seniors shared that they gained practical health knowledge about self-care and aging. One of them shared that she learned how to face and cope with living as an older adult. It helped her to understand how to face various events such as illness and death. The seniors also expressed that they were more motivated to take actions for their own health, and some experienced improvements in their physical condition. So particularly, there was this senior who had a hip replacement surgery done years ago. So when she came to us, she walked slowly with a limp. So she's this very quiet lady who did not socialize much because of her hip pain. And at the end of the program, it really heartened me when she shared that the exercises introduced strengthened her muscles, and her muscles no longer ache that much. So now she has greater confidence and she can move around better. She no longer rejects her friends when they ask her out for gatherings. Previously, she was limited by her hip pain and was afraid of being a burden to her friends when she was out with them.
Right, this sounds like a truly impactful project. So, did you encounter any challenges while performing this project?
Oh yes, the SHAPE program was designed and targeted to address the needs of seniors who stay alone and those who live with their spouse only. So although we approached these seniors based on their living arrangement, they had different health and daily needs, different literacy levels and learning abilities. As such, I had to be adaptive and flexible in facilitating the group sessions and home visits, and at the same time ensuring that the learning outcomes of the program are being met. Another challenge faced was to reach out to this group of seniors in the community. So apart from distributing flyers at the community events and putting up posters at residential areas, we also did door-to-door canvassing to reach out to the socially less visible older adults. It was really hard work, and it took quite a fair bit of time. And many of the approached seniors were quite wary and guarded, as when we were conducting the recruitment, the number of reported scam cases were on the rise. As such, it was important to identify ourselves and to build trust with these older adults. What also helped in recruiting these seniors was the perceived personal benefit in participating in this program.
So, what are your current and future plans for this health resource program moving forward?
At present, I'm working on the validation of instruments to better evaluate this health resource program. And as part of improving the utilization of community resources, such as the senior activity centers, I'm interested to explore what contributes to and increases the activity engagement of older adults at senior activity centers in Singapore. Such activity engagement can expand the size of social networks and improve the psychosocial health of older adults.
So, no man or woman is an island, right? So, I think most of us should also continue to keep a close social circle to stay healthy. So, now let's move on to talk about your charity organization. Can you share a little bit more about that?
Sure. So I'm also a co-founder and a health resource specialist manager of a charity organization named Health Concepts and Measurements, Healthier SG in short. So coincidentally, the name of the charity organization, Healthier SG, has the same name as the Ministries of Health recent white paper, Healthier SG. So this non-profit organization was incorporated in 2020, and we are being established as a registered charity under the Ministry of Health in 2021.
So your organisation is 2 years old now?
Yes.
That's nice. So what actually motivated you to start this organisation?
Healthier SG was set up with a group of like-minded friends to implement the SHAPE SG Health Resource Program and to reach out to more seniors in the community. Like other research involving community-based complex interventions, implementing the SHAPE intervention in a real-world setting compared to conducting it as a pilot randomized control trial is different and challenging. Implementing such complex interventions in a real-world setting involves a lot of coordination and multiple interacting components, such as the behaviors of older adults, the variability in which how the health resource facilitators conduct these sessions, as well as the different environments which older adults live in. So it is unlike the pilot randomized control trial where confounding factors can be controlled in experiments. So from the pilot trial, we saw a potential of the SHAPE intervention as a feasible and beneficial program. The trial actually helped us to understand the demands and resources needed to scale up the intervention. So currently at Healthier SG, we are building and training our core multidisciplinary team. It includes nursing, occupational therapy, physiotherapy, and psychology-trained healthcare personnel to deliver and scale up this program. The SHAPE SG program is now offered to older adults in the community as a service, regardless of their living arrangement. As we conduct the program, we are also keeping abreast with the resources in the community, refining it with the input of different healthcare discipline professionals, so as to make it a multidisciplinary and holistic initiative. As a resource and learning hub, we apply the concepts of implementation science. The SHAPE SG program is evidence-based and is work in progress. For example, we apply the double loop learning. It involves constant reviewing of existing practices on how we run the program, and we are also constantly challenging our underlying assumptions, thinking about why we do what we do. So we constantly learn and improve based on the feedback of seniors receiving the program, our community partners, and the health resource specialists involved in the implementation.
I loved the whole idea of having a multidisciplinary team and doing this closed loop evaluation to make sure that you are constantly improving, right? So do you have any key takeaways for our audience?
So I would like to share that health is actually a process. It is generated from our everyday lives, from what we think, what we do, and what we feel. Likewise, there are no secrets to healthy aging. For seniors, it is about being consistent in everyday lifestyle habits, being responsible and proactive in managing own health conditions, knowing when to seek help in times of distress and illness, and lastly, preparing for the last lap in life. And this is what the SHAPE SG Health Resource Program seeks to do for older adults in the community. So if you're interested to find out about my research or the SHAPE SG program, or even to find out what we do at Healthier SG, please feel free to approach me.
Right. Thank you, Dr. Seah, for sharing more about how you actually developed SHAPE, which is a community health resource program for older adults, and also Healthier SG, which is a charity organization that you've started. You've been listening to a podcast on shaping the health of older adults through a health resource program, part of the NUS Nursing Research Podcast series. With us in the studio was Dr. Seah Betsy, a research fellow at the Alice Lee Centre for Nursing Studies, National University of Singapore. I'm Dr. Jocelyn Chew. Thank you for joining us in this episode and stay tuned for our next podcast.